I was asked a question recently about whether or not perineal massage is a good thing to do during pregnancy to help prepare for labour. And in order to answer that question, I started doing a bit of research around the subject, and it's actually a really interesting answer, and actually it's quite a controversial topic. So what I'm going to go through in this video is I'm just going to let you know what perineal massage is, why we might want to do it, and some of the studies and some of the conclusions that they've reached about whether it's a good thing to do or not, other benefits there are from doing it. I'm also going to describe how you can do perineal massage if you choose it. It's something for you to do. And finally, I'm going to discuss a couple of the products that have come on the market recently that are designed to kind of help with this process. So I just wanted to kind of give an overview of what I'm going to be covering, because I think this video is going to be quite a long one. So first of all, let's start with what is perineal massage. Well, first of all, your perineum is the area between your vagina and your anus. And in fact, on a man, the perineum is basically the area between the scrotum and the anus as well. So it's basically that bit right underneath. And it refers to both the skin in that area, so there's a sort of superficial reference, but also it refers to some of the musculature underneath. So some of the muscles that form part of the pelvic floor muscles are considered part of the perineum. And the context in which you're talking about it will affect which kind of specific area you're talking about, whether superficially or a bit deeper. And perineal massage is essentially massage and manipulation of the tissues in this area. It kind of does what it says on the tin, really. So the reason, why would we do this? Why would we want to massage this part of our body? Well, the idea behind perineal massage is the fact that when we can do massage in this area, it helps us to soften some of the tissues in that area around the skin, but also it can help us to begin a bit of a stretching in that area and preparing some of the musculature and the tissues for the stretching that is going to happen during labour as your baby is expelled through the birth canal. And the reason why we might want to soften this tissue and ready it for labour is because in some instances you can get some injuries in this area if the tissue and the muscle is not stretching evenly. It can be something as mild as like a small graze, but we can see tearing happening in this area. And if there's a lot of tightness in this area and it looks like there might be the tissues are obstructing the baby coming down, or that a tear is likely, you may be given an episiotomy in order to avoid a tear, which is basically where you are cut in the perineum area in order to widen the space that your baby's head is coming through. So this idea about perineal massage is that it will help us minimise those things happening. So it's really interesting because when you start to look at the studies on perineal massage, and there's a number of studies being done, and I posted a couple of links to relevant ones and a couple of relevant articles in the description for this video. It's an interesting conclusion because it does seem that and this is a summary of the studies, that in first time labours, when you do perineal massage around once or twice a week from around 34 weeks onwards in your pregnancy, there is a small reduction in the amount of injury and the amount of tearing and episiotomy that occur in those births. And for second or subsequent labours, there seems to be much less of an obvious benefit, although there was seen some benefit in postnatal recovery time. So that does seem to be that there is some clinical significance there. But one of the things that I noticed was really missing from a lot of these studies was the description of what position the mother was in when she was birthing and when she received the injury or not. So what do I mean by that? When you're in an upright position, so by that I mean anything that's not lying on your back, it means that as your baby's head is crowning, all of the tissues, the delicate tissues around the vulva and the perineum, will be opening nice and evenly around the baby's head. And that even opening is really, again, going to help reduce any risk of injury in that area. So my kind of question is, well, in this study of however many people they had, why are they not recording the position of the mother? Because if you're lying on your back, then as your baby's head is crowning, there's going to be a lot more pressure in the perineum area. So therefore, you might see a higher incidence. So I don't see how you could really judge whether perineal massage on its own is going to actually be the mainly beneficial thing for those people in the study. So I kind of want to offer those studies as some research, but also offer a kind of an aside really to say, actually, perhaps considering the position that you're in may well have just as big an impact, and certainly something that we probably want to research further. So the clinical conclusion of the studies was that there was a reduction in risk. However, the statistics around that are variable depending on the studies that you look, and a lot of them are couched in relative terms. So I think the statistic was it was around a 10% reduction, but that's in the number of cases in the control group to the number of cases out of the control. So it doesn't mean to say that you're only 10% likely. It just means that there's 10% less than that original amount. So it could be 10% of, if the likelihood was that you were 30% likely to have a tear, that's been reduced by 10%. So that's only reducing by 3 in absolute terms. So of course, statistics always need to be taken within their context as well. So the conclusion is, from a clinical point of view, there may be some benefits to doing perineal massage, and it may help you reduce the risk of any injury, tearing or episiotomy in your perineum. However, what is evident outside of the studies, and anecdotally speaking to lots of people in the birth industry, is that when you take the time to do perineal massage, some other things start to happen. One of them is that it starts to get you familiar with your body, because it requires you to put your hands and your fingers inside of your vagina. Now, you may not do this very much, maybe you do it a lot, I don't know, but a lot of people feel quite disconnected from this part of their body, and they don't actually routinely touch themselves in this area in this way. So in the very first instance, it can be a really good way to just introduce yourself to your vagina and start making friends with it, because actually it's going to serve you really well in labour and childbirth. And when you start to kind of get hands-on with that part of your body, you will start to understand, make friends with it, and start to have a bit of faith that it's designed to do what it's going to do, and that you'll probably be absolutely fine. So that's a really great benefit. Another really good benefit is that it can help us to learn to relax the perineum. Now, our pelvic floor muscles can be quite tight, and particularly if you're really active and you do lots of vigorous exercise. So there's certain things like horse riding, for example, that require you to do lots of clenching in your buttocks area and can give you a really tight perineum. And while that might be really brilliant from a fitness point of view, when it comes to having a baby, we want to have a really soft and relaxed perineum as much as we can, so that it doesn't get in the way of the baby coming out, and so the tissues can stretch as they need to. Because as you know, if your muscle is really tense, it's solid and it's not going to move. And again, people often are not in the habit of understanding how to relax their perineum. And so pelvic floor exercises designed to be done during pregnancy will also be a really beneficial thing to do, because during these kind of pelvic floor exercises, we're learning both to clench our pelvic floor, but also, and very importantly, how to release it. And when you do this in combination with a perineal massage, it really helps you to get to grips with this area and actually really feel the relaxation happening physically with your hands as well as within your body. So doing the perineal massage can really enhance that, but doing the pelvic floor exercises are also going to play a really big role in that relaxation of the perineum. So I strongly recommend having a look at how to do pelvic floor exercises in pregnancy. So when you are doing perineal massage, another benefit is that it introduces some new and different sensations into the vaginal area. And some of those sensations we might find that we come across during labour and birth. So when we start doing perineal massage, when we start stretching some of the tissues, and I'll describe how to do it in a little while, sometimes we can feel that the tissue is a bit resistant, and it kind of almost feels a bit like it maybe stings a little bit, or is just a bit resistant or a bit tight, much like when you start to massage a really tight muscle. It kind of feels a bit painful before it gets to the point where it's enjoyable. And actually, the sensations that you have in labour during childbirth as your baby's head is crowning can be quite intensive, and it can have that sensation of stretching of that muscle. So it's kind of useful sometimes to just have a familiarity of what that might feel like. It won't necessarily feel like that, but just to get a sense of what kind of sensations you might feel in this area that might be new to you if you've never had a baby. I think the most important thing that we get when we have perineal massage is, because we've made friends with our vagina, because we're touching it, because we're stretching the muscles, and we can start to get feedback about what's going on, and we can start to feel the way that the muscles are beginning to stretch and beginning to release and beginning to soften. It gives us a lot of confidence in our body, and it gives us a lot of confidence that we are going to be able to push out our baby. Now, remember, your bump might be the size of a watermelon, and we always make jokes, don't we, about how, oh my gosh, I've got to push something the size of a watermelon through my vagina. That's not true at all. Your bump is the size of the watermelon, but actually your baby's head is only about that big. And what do we measure it by? We measure the diameter of your cervix in centimetres. 10 centimetres is the maximum or fully dilated amount you're expected to get. So around that big, if you put your hands together in the shape, that's about as much as it's going to stretch. Now, it's still got your vagina's still got to stretch about 3 times in diameter, but nevertheless, it's much less than having to stretch this much. And the tissues in this area, the tissues of the vagina, kind of overlap, they wrinkle around, and the tissues in your perineum and around your vulva are designed to open and stretch for childbirth. So when we feel confident in this body, when we feel comfortable with it, when we understand we've only got to stretch a little bit, we start to get a lot more confidence that actually our bodies are designed to do this. And we really don't need to stress about preparing the tissues, because they really should know how to do it anyway. But if you feel that it's going to give you more body confidence, if you feel that it's going to help you make friends with your vagina and get comfortable with the sensations that you might feel, and also just help to start the tissues soften, then it's available for you to do. So how do we do the perineal massage? It's really important when you do perineal massage to make sure that your hands are completely clean. We do not want to introduce any bacteria into the vagina, particularly when you're pregnant, because infections can cause a lot of problems for babies. So really important to wash your hands. And you can do this yourself, and you can also have a partner do it for you. And again, that's another benefit. If your partner is doing it for you, it can really help you to create an intimacy that's not a sexual activity in your vaginal area. So that might help to make them feel a lot more comfortable about seeing this part of your anatomy doing something other than causing them pleasure. So where were we? So wash your hands first. Also, if you have a bacterial infection, or you have herpes, then it's strongly advised that you don't do this and don't spread any bacteria around. Of course, you could get some rubber gloves or latex gloves if you wanted to really protect your vagina and protect any bacteria from spreading. That is, of course, an option. It's important to make sure that they're clean as well. It's a good idea to use some lubrication. The general consensus is that natural oils are always going to be better than artificial ones. So, for example, things like baby oil can actually really dry out the tissue. And it's quite delicate tissue. There's quite a delicate balance of the microbiome and all of the mucus in that area. Things like coconut oil and almond oil will be absolutely fine. They'll absorb nicely into that area and are really safe to use. I like coconut oil. I think it's got a really nice smell, it absorbs really nicely, and it's just, yeah, it's a great all over oil basically to use. So we make sure our hands are washed, we get our oil. Now, when you're heavily pregnant, it can be quite difficult to actually get to your vagina. So you need to find a place that you're comfortable, and it can be quite useful to start doing the perineal massage at a point when, you know, earlier on, like 34, 35 weeks, when your bump's not completely massive. You can be sitting and kind of reaching down around your bump. You could be reclining on a bed with your knees up. In fact, I'm going to kind of come back here and sort of show that you could sort of be in this kind of position so you could get in here. You could also try having your foot on a chair and doing it this way. You're limited really only by your imagination, but we're trying to relax the perineum. So when you're in a standing position, for example, it can feel conflicting to try to relax the perineum at the same time as kind of support your body. So I would say probably being in a sitting or reclined position is going to be conducive to helping the perineum relax anyway. So then we've got to get our fingers in the vagina. Now, if you can imagine, the vagina is like this, the vulva is like this, and at the top, if we can imagine, it's like this. So at the top we have the clitoris, and at the back we have the perineum coming towards the anus, and that's the area that we want to be stretching. So we can get our thumbs inside of the vagina and just start by exploring the area and finding the back and finding the side, and you can kind of move your thumbs in this sort of direction. Now, if you can imagine, the clitoris part of the vulva is like midday, and the back part, where the perineum is like 6 p.m. on a clock face. This helps us to describe what we're doing. If we insert both thumbs around the 6 o'clock mark, and kind of push them in at least halfway. So we want to get into the tissue inside as well as the edge. And first of all, we can begin by just sweeping the thumbs out to side. So each thumb is going 1 or 2 points around the clock. So there's a bit of a gap between them. And the idea is to get to the edge of the tissue and then have a little bit of pressure as you sweep. So we're sort of stretching a little bit. And in fact, I've used the web of my hand here, and this is quite a nice way of practicing what that might feel like, is to push the thumb and then just notice the resistance that you get and be pushing a little bit. And the idea is that we're slightly stretching the tissue. And you can continue this for a couple of moments and then stop and release and then try again. Another thing that you can do is to push the thumbs in, or you could try doing this one at a time if it's really awkward. And then you push against the tissue and then you just draw the thumb out. So we're kind of stretching and drawing out at the same time. And this is another method that you can do. And the idea is that you can just practice until you feel a bit of resistance against the tissues. Perhaps it might feel a little bit under strain. Maybe some people say it almost feels a little bit stingy. If it's hurting, that's bad. We don't want to hurt you. And particularly you want to make sure your finger or thumbnails are just nice and short, because you don't want to be like absolutely stabbing yourself in that part of the body. So just working the tissues for a minute or two, maybe up to 5 minutes, and then leaving it. And you only need to do this once or even twice a week for the clinical studies to have shown some kind of effect. Now, it is controversial, and there are many birth professionals out there who strongly disagree with the entire practice of perineal massage, and I personally believe that it's not my place to judge your decision, but what I would say is it's really important to use your brain and make sure you're making an informed decision about absolutely everything, and perineal massage is one of them. So think about the benefits, the risks, the alternatives, the implications, nothing, and what that means for you. The benefits of doing perineal massage is that it could help you to reduce the likelihood of tearing or episiotomy during labour and birth. It can help you to make friends with your vagina and become familiar with that area. It can help you to learn how to relax the perineum. It can help you to feel more confident with this part of your body, and it can help you to create more intimacy with your partner about this part of your body. The risks of a perineal massage are that you could introduce infection into the body, and that is a big, strong consideration, and it might not have any effect whatsoever. And it's impossible to tell what it could have been like if you did or didn't do it, because we can only measure you against other people. The alternatives of doing perineal massage are to do pelvic floor exercises, and also you could use a device, and I'll talk about that in just a moment, to do some of this sort of stretching for you. These are a couple of the alternatives. The implications of doing perineal massage are not particularly big, but the implications are that you probably will find that you feel more connected to this part of your body, and you may feel more prepared for labour. But at the same time, it won't necessarily have any effect. So it's hard to understand really what the implications are, but there aren't really any clinical implications. And if you do nothing, it probably doesn't matter. Your body is perfectly designed to birth your baby without needing any assistance whatsoever. We don't need to train the muscles in this way. It's just a tool for helping us to connect with our body, and maybe there's some benefits, but to be perfectly honest, our bodies are designed to do this, and the success of the human race has been predicated on birth happening successfully. So I feel pretty confident that if you do absolutely nothing, things will probably be just fine. And actually, the position that you adopt during the part where your baby's head is crowning during the second stage of labour will probably have as much of an impact, if not more, on the risks of you tearing or not. So finally, I just want to have one word about the devices. So there's a couple of devices on the market. One is called an Epi-No and the other is called an Aniball. And what they are essentially is little balloons that you insert inside of your vagina, and then you essentially pump them up a little bit with air to a predetermined rate. So you start off with a small ball, and then maybe you increase it a little bit, and so that is designed to encourage your tissues to start stretching, so that you feel confident that your tissues will be able to stretch as much as they need to. So it's kind of a workout, if you like, for your vagina. Both of these devices come in conjunction with pelvic floor exercises. Okay, so actually it's not just the device itself, but a lot of the benefit that you're going to get from using this device will be from the fact that you're also doing pelvic floor exercises. And do you remember how I said earlier, pelvic floor exercises are partly about squeezing, so you can get sensation in that area and feel in control, but also, more importantly, releasing. And it's when you release that the tissues are able to stretch. So it's interesting how many people report that these devices are really fantastic, and the devices themselves will say, we've interviewed all these people, we've done all this research, and everyone says it's brilliant. But in fact, a lot may be to do with the pelvic floor exercises. So it seems really evident to me that whether you decide to use this device or not, the addition of pelvic floor exercises is going to really enhance the process of perineal massage. So I think that's kind of it in a nutshell. It's quite a long and big nutshell, but I felt it was an important topic to cover properly. All of the views in this article or this video are based on articles I've read and studies that I've done. I'm going to list a couple of those in the in the description of the video so you can do your own research, but I strongly urge you to do your own research around this area and make sure if you do decide to do perineal massage that you do it safely, without infection, in a safe and private place. Thanks for watching. If you want to find out more information about pregnancy and labour and birth, please consider subscribing to my YouTube channel. I'm posting videos regularly with guides to different things that you come across in your pregnancy and labour and birth in order to complement the antenatal classes I'm doing. So hit like, hit subscribe, and I'll speak to you soon. Bye.